today is Dr. Andrew Hill from University of Liverpool. He is going to present on a randomized controlled trial of sofosbuvir and decladisvir for COVID-19. Andrew.
Thank you very much, everybody. So we're going to be talking about these two drugs to treat coronavirus, sofosbuvir and decladisvir, which were originally developed to treat hepatitis C, but they are one of a number of repurposed drugs which have been evaluated. So in the results, we saw that 91% of people by day 21 in the sofosbuvir decladisvir arm had shown clinical recovery versus 78% in the control arm. Now that comparison itself was not statistically significant in terms of a pure proportion. When we looked at the secondary analysis with Cox proportional hazard rate models looking at the relative hazard, it was slightly favourable towards sofosbuvir decladisvir. There was a significantly faster rate of recovery with a hazard ratio of 1.59, which was just statistically significant. We then looked at other measures of clinical improvement. We looked at the 8-point WHO ordinal scale. We looked at the severity of lung lesions by CT. And in all of these effects, we saw trends for improved responses for sofosbuvir decladisvir relative to control. So you can see on the next graph with the 8-point ordinal scale, there was a trend for slightly better recovery for people taking sofosbuvir decladisvir in the intent to treat analysis. And similarly, when we looked at the results by CT scan, there was a trend for better improvement in the CT results for people taking sofosbuvir decladisvir. We also looked at survival and mechanical ventilation. Now, in the sofosbuvir decladisvir group, there were 2 deaths versus 5 in the control arm. For mechanical ventilation, there was a 1 versus 5. So we did see these trends, and they're consistent with the previous studies of sofosbuvir decladisvir in Iran, where we saw significantly improved survival for people taking SOF versus control.